Vitamin B12 is essential for functions including DNA synthesis, energy generation, and central nervous system health. Up to 20% of Americans and British over 60 may not be getting enough of the vitamin. Older persons are more likely to have deficiencies because capacity to absorb B12 from diet decreases with age. In this video we will discuss 8 of the most typical B12 deficient symptoms and how this deficit is identified and treated. Number 1. Tiredness. Megaloblastic anemia can be brought on by a B12 or folate deficit. Low B12 levels can reduce the creation of healthy red blood cells, which reduces oxygen supply. You'll probably feel weak and exhausted if your body doesn't have enough red blood cell to transport oxygen to tissues. Number 2. Yellow skin. Anemia caused by a lack of B12 is when the body doesn't produce enough mature, healthy red blood cells. This is similar to iron deficiency anemia and can cause your skin to turn pale or yellow. A B12 shortage can also cause high amounts of bilirubin, a waste product produced when your body breaks down red blood cells. Number 3. Migraines. Headaches are among the neurological adverse effects of B12 shortage and inadequacy. Individuals with specific forms of headaches are more likely to have low B12 levels. Migraine sufferers who take B12 supplements have an 80% lower risk of developing migraines. Number 4. Depression. There is a link between B12 deficiency and an increased risk of developing depression. Low or insufficient B12 levels can cause mood problems and psychosis in addition to depressed symptoms in the brain. The body may experience more oxidative stress, DNA damage, and cell death, which eventually leads to the onset of depression. Number 5. Digestive problems. In addition to these gastrointestinal symptoms, a B12 shortage can also result in diarrhea, nausea, constipation, bloating, and gas. Diarrhea may be caused by illness, drugs, and dietary intolerances. Number 6. Mouth and tongue pain and inflammation. A red, sore tongue is referred to as having glossitis in medicine. A B12 deficiency may be the reason behind it in patients with this deficit. Glossitis can coexist with stomatitis, which is marked by ulcers and inflammation in the mouth. Number 7. Paresthesia in hands and feet. Paresthesia is a burning or pins and needles feeling that affects particular body parts, such as the hands and feet. Metformin can decrease vitamin B12 absorption in the body, putting those with diabetes at a higher risk of developing B12 deficiency. Number 8. Additional B12 deficient symptoms. Vitamin B12 insufficiency can cause a range of physical, mental, and behavioral symptoms. A healthcare provider can rule out a B12 deficiency by measuring levels of B12, folate, methylmalonic acid, MMA, homocysteine, and other factors.